Okay. Hello. Good morning.
Hello, good morning.
My name is Dr. Ali. I'm a doctor in the clinic today. Nice to meet you.
Nice to meet you.
May I confirm your name and age, please?
Yes, I'm Mr. X. I'm 45 years old.
Hello, Mr. X. Mr. X, we are here to discuss some issue related to your health condition. Is that okay with you?
Yes, absolutely. Yeah.
Okay. Before we proceed further, Mr. X, can you tell me more about what you know about your health condition so far?
Yes, doctor. So I came to you last time and I was just feeling a little bit hot and I guess I'm feeling not my normal self. I thought I should just do a checkup and you did some blood test for me and I'm here today to discuss the blood results with you.
Yes, I highly appreciate you know about your knowledge. And you do any expectation, Mr. X, for your results?
Uh, I hope it's fine. Yeah. I don't know, but I don't have certain expectations, but I hope it's not serious.
Yes, Mr. X. Actually, the result with me released now, and it is not as we hope, Mr. X.
What do you mean?
It show you have a disease called hepatitis C.
Oh
Do you
dear.
hear about it?
Yeah, so I know it's like something affecting the liver and it sound to be like very scary. Is it serious, doctor?
Yes, exactly. This is affecting your liver. Let me explain more, Mr. X. First of all, it is not serious, but let me to explain, and we'll share you all information about this. Is okay?
Yeah, okay.
Okay. Mr. X, this hepatitis C, it is a viral infection affecting your liver, and it is sometimes appear without any symptoms. Sometimes people reflect some symptom like feeling tired and hotness, like what you have. And this disease by time affecting, and sometimes there is yellow sclera of eyes, and this disease by time affecting liver function and lead to liver damage and make soreness in the liver and lead to damage and scarring of the liver, Mr. X.
Mm.
Do you follow me?
Yeah, I'm following, but when you say the word damage, it makes me very scared. Is there any cure for this disease?
Yes, Mr. X. The good things in this type of infection, it is almost curable. So don't worry about this. We are here to discuss all modality of treatment with you, Mr. X.
Okay.
Just first, I want to explain more about the complication of the disease if left untreated, so that way we'll be in the same page to manage it well. So that this disease, if not treated well, can affect the liver, lead to liver damage, scarring the liver, and even sometimes after many years can lead to cancer. So that's why, Mr. X, we need to arrange a plan of management together to be sure to prevent this complication to happen to you, Mr. X. How does this make sense for you?
Yeah, it's fine, but I'm a little bit scared. Yeah, talking about cancer and yeah, but
Uh, Cancer, it is ultimate stage of this disease. We hope you not reach that. As we discussed before, it is curable all most cases. So don't worry about this. If you will be adherence to medication, we will discuss later and follow up in the liver clinic, which I will refer to your liver doctor. It will be good, and almost you will not got such complication, Mr. X.
okay.
Is that okay?
Yeah.
So that's why, Mr. X, we need to refer you to liver clinic. The good things there is now management. There is medication available for this infection, hepatitis C. So we refer you to liver doctor. He will prescribe you medicine, almost the tablet. We need to use for a long time. We need from you to be adherent to this tablet, and we need from you to be in regular follow-up. As your liver doctor will arrange to you uh, and regular follow-up to follow your improvement with medication. Is
All
that okay
right.
with you?
Yeah, fine.
So that why this medicine for hepatitis C, it is almost oral tablet,
Mm-hmm.
and almost you will give you in two type of tablet together. And like any other medicine, there is side effect of this tablet. But don't worry, we'll give you the suitable dose for you, and we'll follow you in the clinic. Sometimes it will cause GIT, these gastric upset. Sometimes can called dry mouth and rash. But don't worry, we'll follow you regarding side effect, Mr. X. We need from you to take this medicine regularly and to be adherent to your follow-up. What do you think?
Yeah, it sounds sensible for me. Yeah, that's fine.
Okay, so that's why, Mr. X, just I want to ask you some social question to complete our management plan.
Mm-hmm.
Are you married or have regular partner?
Yes, I have regular partner, but I went into holiday and I had sex with the girls there.
I'm sorry for that, Mr. X. That what I want to tell you. This mode of transmission of this disease can be happen with unsafe sex, can be happen with the blood sharing needs, can be happen with the blood transfusion before 20 years. Now blood transfusion less likely to cause this. We don't know the exact mode of transmission, but now we need from you, Mr. X, to bring your partner to test uh, for uh, for the disease for this hepatitis C, and to know if she have also can be treated early. What do
But
you think about telling her?
no, because my wife, she will know I was cheating on her, and I don't want her to know about it. Sorry, please, doctor. Can you not let her know? Can it be
Uh,
confirmed?
yes, this you're right, Mr. X, to tell your wife. But as you know, this disease, if discovered early, can be treated, and we know you don't want her to harm her. So if we discover her early, we can treat it early, and we can make a meeting with her to explain. And to explain to her how we can investigate her, how to can treat. And you cannot tell her about source from you if you don't want this.
No,
What do
but
you think?
she knows yeah, like it's sexually transmitted, and she will know that I was treated for the same problem like her. So and she doesn't have any other partner. So I think she will conclude that I was the reason, and she will we will fall apart, and this is something I don't want to happen. So I don't want my wife to be involved at all.
Okay, Mr. X, if you don't want now, this is your right. We can involve you another meeting to discuss this issue. Meanwhile, we want you now to practice safe sex with her, Mr. If she's not getting the disease yet, to not getting in the future. So that's why we need to practice safe sex with some measure, Mr. X. Is that accepted?
Yeah, yeah, fine. Surely I will do that.
Okay, thank you. And what's your job? What you do for living?
I'm a sex worker.
What?
Sex worker. So I work
Uh,
in, yeah.
okay, okay. Also, I think this is maybe you need to involve occupational health doctor because this job now it will be hazard job. So involve the occupational health worker regarding this to help you and to arrange with you. Is that okay with you?
Yeah, so are they going to inform my employer?
Uh, I'm not sure if you don't want to inform them, Master X. I will ask my consultant, then we will see how what we can do regarding this. But we need to involve occupational health. I'm sorry to tell you.
So you said you are not sure. So are you going to inform him or not? Like you inform the occupational health and then you will let him do whatever he
Now
thinks.
we will let you to inform your employment if you
Mm-hmm.
will inform them. Otherwise, I will make you a meeting with my consultant
Uh,
to
okay,
discuss with you about this.
okay. Time's up. Thank you. All right. So,
10
Eris,
minutes
tell
خلصت؟
me. Yeah, time finished. So, how did you feel about your performance?
طبعا ما عملت الكونسيرن فتأخرت
No, it's
يعني.
it's okay because you asked me in the beginning about my expectations, and I feel like you addressed my concerns throughout. I don't have any more concern for you, so it will not be like major issue for you unless the patient has concern and is still not being addressed, it will drop your marks. But for me, this station, even I added one more concern just because I thought you have some defect in the legal issue. So I wanted to make it harder for you. So I added one more concern. I made myself sex worker, which is not the case at all. But um, the what else? Like I feel like you are fine regarding the concern. What else?
And I want to ask about alcohol
Yeah, it could
because it
be.
affects.
Yeah, it could be a good point to add in. Yeah, because of the liver issue. Yeah. But it will not minus you because the examiner will put in their mind the time restrict, and it's all about checking your communication skills. So never ever get distressed if you missed anything. You can get still full marks if you miss something, but overall you have to be good. So I feel like you were excellent. You have the right skills. Like you speak clearly, confidently, and which is something really like essential, like to pass communication skills. So, like many people feel like communication skills is just about addressing this approach 1 plus 2 plus 3, and no, it will never work like this. Even if you didn't do lots of things, it's all about your general approach. So you are very organized. You are like having sympathy. You could add more sympathy and sympathy to me, but I think you offered reassurance throughout and check understanding. But I think you could offer me even more sympathy and empathy. Like just work on this. Try to memorize sentences, long ones by heart, and just say them. Like 2 sentences and just say them all at once. Make the examiner, wow, this is nice, and then tick tick regarding sympathy and sympathy for you. Because like just don't worry on and very simple sentences. Sometimes it doesn't feel strong enough. But yeah, this is something you need to just increase, like exaggerate. Honestly, for me, normally, even in the real life, lots of sympathy and empathy. And patient like it, and examiner like it. So just try to overdo it, please.
That's my problem. Always
Yeah, it's a
practicing.
problem with all men because they don't like so kind. All men. For female, is this part of us like in Sudan we say kiser telling like breaking ice, which is like just
Always this my defect.
yeah, so all men has problem to be super kind because like you're very practical, but please, yeah. Sorry, there's some noise. Whoever like has this background, please mute yourself.
You can
Sorry.
mute him. You can mute him.
Someone have background. Let me mute them. Sorry, Mr. Jess, do you mind to mute yourself? Okay, fine. Yeah. So yes, yeah, try to work on more sympathy. Yeah, you offering reassurance. You told me once, I think you are not alone in this, which is also good, but I'm still overdo it because the examiner will like it. So in my exam, for example, I didn't do like followed any course because I was teaching communication skills for the past 4 years. So I thought like I should focus on something else, long consultation, whatever. But the thing that's why I didn't do the exam perfect, but it's still like I dropped only 2 marks in my stations because like just I was super duper kind, and this is part of me. In addition to the overall skill like organizations and having introduction as you did, it was excellent. Like the way you did it, I think you have good communication skills, which makes me like feel like you will pass your exam regardless, because you have the skills they want. Just add more sympathy and empathy for me, please. Yeah. And like, yeah, so you cover the main things about counseling regarding disease, like you took me through the symptoms, complications, and the good things, like you took the point of the patient is scared from having a cancer. Like when I thought you like, oh, I'm scared about the worst cancers, you offered me reassurance, and at the same time you used this fear I have to convince me like to be coherent to my medications, to be regular on my follow-up clinic, which is excellent point. So I love it as well. I gave you stars for this. So I think you excellent and you are natural, mashallah. And you fluence. You don't feel like scripted or follow any script you have in your mind and just ABCD for me. So and this is all it needed to pass clinical communication skills. Like many people, they just memorize by heart, like this station, I should ask this ABCD, and they will sound very robotic and they will get very low marks and will be surprised. I covered everything, but the examiner is tough. No, because they're assessing your skills, they're not assessing your knowledge. And it sometimes will be written for you all in the task outside, what you need to address in the stations, but how to address it and how to address all the concern as they arise, and to listen to the examiner, to the candidate or whatever surrogate, sorry, and not ignore any concern. For example, when I told you, is it serious? You told me straight away, it's not serious, but let me discuss with you whatever the next steps. So it's good not to ignore any concern. And I'm just checking on the marking criteria. I see like seek, detect, acknowledge, and attempt to address patients' concern, which we did. So as you mentioned, just if you can ask early on, because like you will never the time in the exam, even it runs faster because of the stress. So ask about the concern early on. Like you don't need to wait for the end of like the clinical consultations. In the communication, you can ask the concern even in the beginning of the stations. So after you ask about expectations, or maybe after you just discussing the disease, may I know what is your main concern? May I know what is your biggest worries after just you disclose the diagnosis? So it will make you safe, like regarding the concern part. Even if you have time problem in the end, in the like what happened now, so you will not be marked negatively for that. So I will ask the concern early on, like maybe before the social history. Ask the concern and then ask the social, because the social is not included in the marking, it's just top up. Yeah, you have good clinical judgment, and the good news that you know that the nowadays hepatitis C is like almost treatable, like and this is the in the exam, like in the true case, the main concern for the patient, like is it curable or not. So this is important information for everyone to be aware about. The nowadays hepatitis C is curable, not as it used to be in the past. So clinic, like I can give you full mark in everything, honestly. So just keep the good works. And in the last like 2 minutes, you started to get distressed and your sound rumbled a little bit, or like, or maybe just even pronunciation in some words get off. So please try to keep calm to the end. Like just in the exam, remember, I did my best and no one is killing me. Whatever, I'm gonna do my best, okay? And whatever happened is happened. If I failed, this is for good reason for me. And if I passed, also for good reasons. I'm just like complete reliance on Allah, and just believe on you will be like you will get the best for you, because sometimes we don't know what best for us. Sometimes failure could be the best thing could happen to someone in their life. Like lots of people who like teaching, whatever, or for example, writers failed 4 times and he made books in teaching basis. And now all of us studying from it. He will be like for the rest of his life, people following his excellent books. So Please just do your best in the exam. Don't get distressed because the exam is easy, but the stress can take it all. So excellent. Honestly, just work in your sympathy and empathy. And I'm sure you know about this legal issue, but confidentiality. So you will tell the husband, his wife. You told it's your right not to tell. No, it's not his right. Your wife had the right to know about this disease because she needs to be cured as well. And your employer, the same issue again, needs to know because you will be at risk of transmitting the disease to other people, which is not legal at all. So you will try to convince him. You will never tell him, I'm going to break your confidentiality. You will try to convince him, and if he refused, and you tell him this is legal obligations, and if he refused, as you said, you will arrange another meeting with the consultants, because the consultant, he need to involve legal department. We don't opt for breaking confidentiality as a doctors easily at all. So we'll try all means. We'll do our best to convince. So, and they're expecting you to make effort to convince yourself before you uh, point out about the consultant, the meeting with the consultant. So please try to make effort to convince him as you did, because if the disease detected early in your wife, so she will be treated and you will be treated, and the chance of transmitting the disease for each other will be reduced or minimized. So well done, excellent. And I think you can pass your exams. Honestly, don't worry at all. It just, uh, even honestly, you can save time for doing something else because I feel like you have the skills. And I asked the same question, when I did here course in London, I asked, we had a mock exam, so I asked the examiners, I don't have time for communication skills. Uh, like I only have 1 month. What do you think? Should I study communication skills in this 1 month, or I will be passed according to my just assessment right now? He told me you will pass your exam according to assessment, and I will say to you, you will pass the exams according to my current assessment. So don't worry at all. Just keep it up. Keep it up, and in the exam, just go with all this positive feeling. I'm excellent. I'm good. I'm going to master it. So well done. And I think the meeting will end at any times, but I think um, you covered the main things in the stations. And as I said, there is no wrong or right answer. It's all about the skills. So if you have excellent skills and you cover the major thing, especially the thing written in the task. Nowadays, they bring the task like one papers full of things, which is really annoying. But you have to remember, and the good thing, you will have the paper with you inside the exam as well. So take it with you, underlying all the things you need to address in the station. If you missed anything, they will drop your marks because they need to make sure you're not coming with anything in your head. You just saying what they ask you to say. So the task will be very long.
معلش يا دكتور، الورقة
Yeah.
بشيلها مني حنقول في الورقة
No, no,
البيضاء
no, no.
ولا
You will
حكون؟
take it with you inside the exams, and you will read it from it and speak to the patient normally without any problem.
تمام.
Yeah, yeah, we'll take it with you. Don't worry at all. And you have outside 5 minutes, more than enough to remember everything. And inside, and just when you are preparing outside, try to practice your introductions, because when you start good, eventually you will have this confidence to continue good. So always try just to yes, I will organize myself, like this is my introduction, this is my main topic, and this is how I will end the stations. I will discuss this area and underline them in your papers, and try to practice a little bit because the time is too much, 5 minutes. And then when you go inside, you will be more confident. Yeah. And remember, sympathy and empathy, they bringing lots of breaking bad news and lots of traumatic stations. So work on the sympathy and empathy, even in the tones when you showing sympathy and empathy. Like in my station, I almost cried with the patients, and I sat on the floor for her. And just she was crying and just sitting on her leg in the floor and saying like, I'm so sorry, and this is life. I know it's so hard. I wish I could do anything to help you. And just you have to make it up. You have to show your skills.
طيب سؤال.
Yes.
If like here disease is manageable and curable, I need to mention this, not we hope silent shot like this.
Yeah, I think you did it right. Yeah. Like if it is breaking bad news, you need to break it even into more steps. But you did it in on only two steps. It's not as we hoped, and you said it to me. So it's just like you gave me a shot to be prepared for this news, and because the disease is curable, it's not like extremely bad. But if you're talking about terminal disease, I think I would break it into like 4 or 5 steps. I will not tell the disease straight away. So I will be like,
Yes, yes, because that way I try to make sure because it is
yeah,
not harm. Otherwise, I will tell it is not good. I will
as
wait
we
long time.
hoped. Yeah. So
We
I
will
think you
think
did it excellently. Yeah. Yes.
about
Yeah.
cancer.
Yeah.
I need to mention, if not if disease explanation, I need to touch the drug and side effect and name of drug.
Just if the patient is scared, I would not speak about side effects at this moment because, like, I feel like to convince me what you did, like, to be coherent to my medication, like compliant and take them as prescribed. So I think it's more than enough. It's not the right time to speak about side effect because I'm already scared about the diagnosis. You're not going to scare me about the medications, and unless there is some medication like very serious side effects, for example, talking about TB, you know that they will affect the liver, so you can touch in this point. But I don't think hepatitis C medication they have like common serious side effect that could happen imminently,
Yes,
like you need to warn about. Yeah, so
yes,
it's
I got
okay.
point. Unless opposite to if they mention explain a new medication, so that's why we run.
Exactly, yeah. If the station about talk about the management of this disease, so they want you to speak in details about treatments and side effects and risk versus benefits. Yeah, like you give it more times. So you need to know your main task in the stations and give it the focus, and then touch in the other area just quickly. Okay. Yeah, just you can ask me like, how are you feeling now? Maybe just before you end the stations, may I know how are you feeling about the new diagnosis? Do you have any worry? So sometimes they can have even like they need mental support or counsel, whatever you can offer if you feel they are very distressed with the diagnosis. So it depends on the patient, but we need to ask, may I know how this news left you feeling so you can see if they need any like psychological support or not.
Okay.
So like just to summarize for everyone, like this is stations about counseling about disease. And when we counsel about any disease, we have our fixed introductions, as Dr. Mohammed did it excellently. So I'm not going to speak about that. And we need to educate the patient about the disease, the symptoms and the complications, and discuss the treatment options. And the most importantly, to make them involved. As Dr. Mohammed did, like we have to tell them, is it okay with you? We're going to discuss with you the treatment options and see what suit you best. Like always, it has to be their plan. It has to be patient centered. So it has to be their decision about the disease. And if you omitted these sentences, they're gonna drop your marks. So always you have to show the examiner that you involving the patients in everything you suggest. You will never impose anything on them. You have to discuss with them the options and ask them about their opinion regarding this options. So is it okay by you? And so on. And check understanding throughout. Whatever you say, any sentences, check understanding, check feeling. Always it has to be two-way. Never ever talk for lengthy period without checking the patients. And we have to like promote liver health, like I speak about alcohol. If he drink alcohol, we advise like to avoid that and prevent transmissions. So we give advice about